Every year, millions of people undergo spinal surgery, hoping for relief from pain or recovery from injury. But while surgery offers the promise of healing, it also comes with risks, some of which can be life-threatening. From nerve damage to infections, blood clots, to spinal instability, post-surgical complications can occur unexpectedly. What happens when the healing process doesn't go as planned? What should patients and their families be aware of both before and after the procedure? Today, we are going to focus on spinal surgery complications, how they happen, and what to watch out for, as well as answer your questions on this episode of Ask the Doc.
Send in your questions to questions@allhealthtv.com or AllHealthGo on Facebook or YouTube, or visit the Ask the Doc page on our website, allhealthtv.com.
Welcome to Ask the Doc, the show where we encourage our viewers to send in their health questions. I'm Dr. Georgiy Brusovanik, a minimally invasive spinal surgeon. Let's start things off with a Facebook question from Nico, who asks, "Hey doc, I had an epidural injection last year for my chronic back pain. It initially worked like a charm and the pain disappeared, but now the pain is back and worse than ever. And to add insult to injury, I'm getting headaches as well. Could this be related to the epidural?" Nico, I'm sorry to hear that you're in pain again, and you may be right. The epidural could very well be the culprit, but it gets a little more complicated because you mentioned headaches. So there's something called an epidural headache, and it occurs when a lumbar puncture, which is what an epidural is, results in a persistent leak of the fluid that bathes the nerves, the cerebrospinal fluid. So patients will then complain of immediate onset headache after the epidural. And one particular feature of that headache is that it gets worse when you sit up or stand, and it gets better when you are laying down. Now, if your pain occurred weeks, months, even days after the epidural, then it's not caused by the epidural. And unfortunately, there's a big urban legend that epidurals cause back pain, and it is completely false. There's a reason for this, though. One, patients who have back pain occasionally get worse, and patients who have back pain occasionally get epidural steroid injections to try to avoid surgery, to try to alleviate their pain. So there could definitely be a sort of a retrospective bias saying, well, I had an epidural and that's why my pain is now worse. This is not accurate. It's at the best a correlation and not a causation. On the other hand, we often see patients who are about to give birth have an epidural in order to ease the process of delivery. Now, pregnant girls get back pain, bad. So then there's another bias in that, oh, well, I had an epidural, now I have back pain. Again, it's not accurate, and an epidural would not cause back pain. In fact, I encourage most patients to try an epidural, Nico, because it helps patients avoid surgery, and it helps me as a surgeon to solidify exactly where the pain is coming from. So for me, it's a big diagnostic thing as well. That's a really great question and very much relevant to a lot of people. Thank you, Nico. Our next question comes to us from Marianne, who reached out on YouTube. Marianne's question is, my husband Artie has a tough time sitting still. He recently had disc replacement surgery and developed blood clots. Could it have been from the surgery itself or the fact that he started fixing stuff around the house soon after the surgery? Sometimes I feel like a detective. I have to really piece together the story to find the true conclusion. And I love doing this, but your question really lends itself very well, because having a hard time sitting still is actually a function of pain coming from degenerative disc disease? It's the first question that I ask my patients when they come in with an MRI showing a degenerative disc. Do you fidget when you sit at the dinner table? Do you have a hard time sitting in the car for a long period of time? So, Marianne, I don't think it's Artie's fault at all that he developed blood clots. Moving around after surgery is essential. In fact, that's what prevents blood clots. But when patients undergo disc replacement surgery, especially at the L4-5 level, a surgeon has to mobilize the great vessels. Sometimes that may result in some vessel compression, and the stasis, or the sort of slow flow of blood at that point, may predispose patients to blood clots. My advice is to definitely seek medical care if your legs become swollen or if you develop significant pain in your calves. An ultrasound is reasonable to rule in or rule out a blood clot. And for those who have had disc replacement, in my experience, and I do disc replacement a lot, it's very important to start an aspirin, unless otherwise contraindicated, because it will lower the risk of developing a blood clot. That's a really important question, Marianne. And again, I'm sure that this question is relevant to so many of our viewers. Oli reached out to us on the YouTube page, as the next question is, "Hi, Dr. B. I had a cervical disc replacement surgery last month. My neck is feeling okay, but I'm having difficulty swallowing, and I've got hoarseness to boot. My surgeon's not returning my calls. Could something have happened during surgery?" Oli, I'm sorry to be so direct with you, but you're definitely having a complication. The anterior cervical surgery, which is what's done for disc replacement, does predispose, especially when it's done sort of with the older technique where there's a lot of cutting, it does predispose patients to have an injury to a single nerve called a recurrent laryngeal nerve. That nerve innervates the vocal box. And whether that nerve gets cut or stretched, patients may report difficulty swallowing and hoarseness. Now, look, the good news, Ali, is that 90% of patients get better within a year. But what concerns me more about your question is that your surgeon is not returning your calls. That really bothers me a lot. Sometimes patients ask me very directly, "Are you the best?" And my answer is, what would define the best surgeon? My answer is that it's a surgeon who will be with you if there's a complication. Going to surgery is like going to war. It's like going to battle. And there will be complications in some cases, and there will be some pain. But in order to know whether what you're experiencing is normal after surgery, you need to pick a doc that's going to pick up the phone and communicate with you. And if your doc is running out of the room at the first appointment where you just meet him, consider that a big red flag and try to get a second opinion. Oli, I would get an upper study, a swallow study, in order to address your issue with swallowing. And I would definitely seek a second opinion as soon as possible from another spine surgeon. I'm sorry you're suffering. In case you missed it the first time, here's another opportunity to find out where you can send in your questions.
Send in your questions to questions@allhealthtv.com or AllHealthGo on Facebook or YouTube, or visit the Ask the Doc page on our website, allhealthtv.com.
Welcome back. Xander sent this question via our very own website, allhealthtv.com. Xander asks, "Hi, Dr. Brusovanik. My mother, Arlene, just hit the milestone age of 80. She's in pretty good shape other than the fact that she has degenerative disc disease and is scheduled for surgery next month. My question is this: are there any specific age-related risks when it comes to spinal surgery complications?" Hi, Xander. I'm sorry to hear that your mother needs to have surgery. I'll be honest with you, surgery is always a risk at any age, but as we get older, there's always a chance of more complications. So it's a long list. Some of these you can control, particularly picking the right surgeon, and making sure that your mom's bone quality is good. So I would ask your doc to send you a prescription for a bone density test, because if your mom at 80 has significant loss of bone quality, such as osteoporosis, your surgeon may want to know that in order to avoid certain specific surgery-related complications. And there are things that your surgeon will be able to do with that knowledge to circumvent the potential problems. Now, look, at 80, you got to consider high blood pressure. You got to consider arterial atherosclerosis, or when the vessels get a lot of calcium plaque and become crunchy and friable. You got to consider pulmonary function. You got to consider padding, in that when a patient is laying for surgery, everything has to be padded so no bony prominences are touching anything metal, anything hard. Look, it's always a big production when it's a patient in their 80s, and I take that very seriously, but at the same time, being 80 doesn't mean that you can't have surgery. I tell patients who come to me who have such significant age that it's not the age that matters. It is your current personal medical problems. And we shouldn't use just a general gist to figure out the severity of the risks. We talk to medical consultants, cardiologists, primary care doctors, who will look at the big picture and who are going to provide an additional opinion about the risk of the operation. It's also very important, especially with such age, to seek a surgeon who does minimally invasive surgery. At 80, narcotics are going to be a problem. They may cause delirium or acute mental status change. Your mom may start to act strange. She may not even recognize you, which is very difficult for patients to deal with. So make sure you talk to your doctor about post-operative pain management and quiz your doctor about what technique do they use. You can avoid a big, wide open incision, which will take months to heal. And with the newer techniques, you'll find younger surgeons performing procedures at a much more rapid pace with much less complications. Xander, good luck to your mom. At your service if you have any more questions. All righty. We've got another question from allhealthtv.com. You should really check out our site when you get a chance. It's chock full of really great information. Pandora asks, hi, Dr. Brusovanik. Our son Chase had spine surgery for scoliosis about 8 years ago. The surgeon put in hardware during the operation, and it helped to straighten Chase's back as well as alleviate the pain. But his kid kept growing, and now it seems like his spine is somewhat curved again, and he's complaining of constant pain. Could something have happened to the hardware in his spine? And if so, what can we do now? Hi, Pandora, thank you for this question. And I'm sure this is very relevant for a lot of patients who undergo big scoliosis surgery. Look, with big scoliosis surgery, the goal of the operation is to put in screws, straighten the spine, and create what's called a fusion, meaning to make all these crooked bones knit together. Now, in an attempt to get all these bones to knit together, there are two possibilities that are most common. One is that as the bones take their time to heal, the metal may undergo fatigue failure, as in with constant motion, eventually screws or the rods may break. And then you see this picture a year or two after surgery, maybe even longer, where suddenly the pain is way worse, and it appears that the correction from the scoliosis surgery that originally was so obvious has now somewhat diminished. The other possibility in patients, and it's the same timeline, is that a disc above the fusion or below the fusion has deteriorated, and it can also present with severe pain. So for the possibility of an adjacent problem above or below, you got to get your kid to have an MRI. For the possibility of a failure coming from the operation itself, my advice is to have a CT scan. Make sure you go back to your doc and you tell them exactly what you told me. Pandora, it's very, very important. Post-surgical complications must be treated seriously, and your doc must be aware of what's going on. It is his job, it is his responsibility to guide you through this process. And like with an earlier question, if you do fall into the trap of having pain after surgery and your doc is not returning your calls, That is not excusable. That is not okay. So definitely get a second opinion. And even if another surgeon is not the one who did your surgery, an ethical surgeon will take you in and will take care of the complication. Thank you for this really important question. This next question is on YouTube, and it comes from Andre. Dr. Brusovanik, I am in pre-game, which means I'm getting ready to go under the knife for lumbar disc replacement surgery. I'll be honest with you, I'm a little nervous about it, Andre, as you should be. Now that I've got that off my chest, I'd like to know, what are the most common complications that can occur after spinal surgery? Andre, it's always scary when you hear the word surgery. And that's why we always try to avoid surgery with epidural steroid injections, with conservative means. But let me see what I can do to allay your fears. Now, we can't just generalize all spine surgery in creating a list of complications, because complications are procedure specific. But with lumbar disc replacement surgery, the list is very specific and it's pretty short. Before I give you that list, let's check out this video from the folks at the Mayo Clinic.
Most of the back surgery we do are not high-risk surgeries. I think people think going in that this is, boy, there's a 50% chance I'm going to be paralyzed or something like that. The reality is that the major catastrophic risks of spine surgery, or any surgery, death or spine surgery paralysis, those are less than a fraction of 1%. Is it possible that those things can happen? It is possible with any surgery, and we tell our patients that. But those catastrophic complications are extremely low risk. More common complications would be things like an infection after a surgery, but even that's probably in that 1% to 2% range, which is not a lot, but does happen when you do hundreds of surgeries over the course of a year. So that would be more common. Probably the most common complication that I mentioned to patients when we're talking about lumbar spine surgery is what's called a disc recurrence. So someone has that disc protrusion or disc herniation pushing on a nerve root, we go in and we take that disc fragment out. The medical literature said there's about a 10 to 20% chance that you might have more disc material come out and push on the nerve again, causing a recurrent problem. So that means 80 to 90% of people usually do just fine and don't have a recurrent problem, but 10 to 20% probably do have another problem, which may require another surgery.
Andre, so you're having lumbar disc replacement surgery. What are the specific risks? Number one and most important risk is a risk of fracture. For that, your surgeon should have ordered you a bone density test. If there's any indication that your bone quality is imperfect, your surgeon needs to know that before the operation, because there's something he or she can do to circumvent the problem. They can strengthen the bones with cement, which would make it so that the risk of fracture will diminish precipitously, almost to nothing. Other risks. If a lumbar disc replacement is done at L4-5 or above, a surgeon will have to mobilize the great vessels to get to the front of your spine. So there's a risk of vessel injury. There's also a risk of blood clot, like we talked about earlier. And for that, I advise patients after surgery to take an aspirin, simply 1 adult dose aspirin per day. Talk to your doc. And look, when it comes to surgical complications, studies are one thing, and it's important to get an idea about the possibility of complications from studies. But I would definitely quiz your doctor about the complications that he or she has seen in his patients. Everyone's technique is a little different. And on top of that, a conversation about complication will give you a really good opportunity to test your doc. If they're squeamish about telling you what complications they have had with their own patients, that's a red flag. If they're rushing through the discussion about complications, that's a red flag. If they're not making eye contact, if they're not being forthcoming, that's a red flag. And there's no better time than at that first appointment to pick up on these signs and clues and seek another opinion. It will be too late after surgery. Thank you for this really important question, Andre. If you've got questions, we've got answers. And just in case you missed it the first time, here's yet another chance to find out where to send in your questions.
Send in your questions to questions@allhealthtv.com or AllHealthGo on Facebook or YouTube, or visit the Ask the Doc page on our website, allhealthtv.com.
Clark sent us another question on YouTube. Clark asks, "Hey, Dr. Brusovanik, I had neck surgery a month ago, and the pain in my neck and the nerve pain going down my arm is gone. Perfect. But as fate would have it, I now have severe back pain when I sleep on my side. I also have difficulty reaching over my head as well as reaching behind me, like when I'm in a car. Could this be a complication that's the result of surgery?" Clark, I wonder if what you meant was that you now have severe shoulder pain, as that would produce a common problem after neck surgery, which would include difficulty reaching overhead or reaching behind in the car. So about 80% of patients who have a neck problem or neck surgery will try to avoid moving their shoulders. This is a natural response as your body tries to use the muscles, produce muscle stiffness to limit the motion of the painful part. But the traps originate in your neck but insert into the shoulder. So many patients after any kind of a neck procedure or with just a disc problem will stop moving their shoulders. And then check out what happens. Pain at night where it's worse when you sleep on the side, pain reaching overhead, and pain reaching behind in the car. It's a very typical picture. So this is like the best complication to have because you can fix it, Clark. You've developed adhesive capsulitis or just a tight shoulder. You don't need anything complicated here. You don't even need to go to therapy. Look up 4-quadrant stretching, and you will see these basic exercises that require no tools at all that will show you how to stretch your shoulder properly. If you give it a week of good quality stretching 10 times a day, you may just resolve this problem altogether. Some patients may require a steroid injection to help alleviate this pain, but then they still have to undergo stretching. So this is called adhesive capsulitis or a tight shoulder. Good luck stretching, Clark, and let me know if that doesn't resolve your problem. Our next spine-related question comes to us from Daphna, who reached out on Facebook. "Shalom, Dr. Brusovanik. I was recently in a car accident and a surgeon had to fuse my spine. Everything seemed okay the first couple of days after surgery, but I was just informed that I have a spinal hematoma and I need to go under the knife again. First things first, what is a spinal hematoma? And is this a result of the accident or the spinal fusion?" Daphne, it's hard to say whether it's from the fusion or from the accident. I'm concerned that you're having to go under the knife again, but I haven't heard you say why. Hematoma is common after surgery, but it's rare to be symptomatic. In some cases, a hematoma may be very dangerous. If it occurs in the canal, it may compress nerves. So if after surgery you feel worsening numbness or pain going down the legs, then an MRI may reveal a hematoma, and that does need to be addressed urgently. But you're asking me questions that your spine surgeon should have answered you. And I really hope you are able to reach your spine surgeon and your spine surgeon addresses your questions directly. Make sure that that's the case. And if not, please seek a second opinion as soon as you can. Thank you for this question, Daphne. I guess it's an all health TV kind of a day. The next question to us is from Ruth Ann, who asks, "Hello, Dr. Brusovanik, can spinal surgery lead to nerve damage? And if so, what are the signs a patient should watch out for?" I'm asking because I had a laminectomy, and a few weeks later, I had difficulty walking. I felt like my right leg had lost strength. Ruth Ann, unfortunately, you may very well be right. Any kind of intervention that involves working in the canal, in the spinal canal, may risk injury to a nerve. A laminectomy is a procedure where you unroof a canal and create more space for compressed nerves. In fact, a laminectomy is frequently done for difficulty walking, for patients who have to use a shopping cart to get around, for patients who have no pain when they sit, but then when they stand up, they're flexed forwards and have a difficulty going any significant difference because of leg stiffness, pain, or numbness. But what you have is definitely a complication. Ruth Ann, I would urge you to speak to your surgeon because what you are experiencing is not normal after a laminectomy. This deserves urgent attention, Ruth Ann. Nobody should be worse after surgery. And it happens sometimes, but it's very important to pick a surgeon who will be there for you and will help address the problem. We have the next question from allhealthtv.com from Avery. Dr. Brusovanik, how common are surgical site infections following spinal surgery, and what are the early symptoms to watch for? Avery, that's a super important question, and I'm sorry we're running out of time. Infections happen between 2 to 3 weeks. They are almost unheard of when it comes to neck surgery, and they happen in about 1% of patients with low back surgery. An infection means that you may have purulence coming out and you may have fevers, and it's very important, if you see any of that, to go back and talk to your doc. To those of you who are about to have surgery, please keep in mind that your surgeon is there not just for the procedure, but for the recovery. And for those of you who are having a hard time reaching your surgeon, please make sure to call another surgeon who will likely be very happy to help. For those of you who sent in their questions, thank you. These questions are very meaningful, and I look forward to speaking to you again on our next episode of Ask the Doc.
Send in your questions to questions@allhealthtv.com or AllHealthGo on Facebook or YouTube, or visit the Ask the Doc page on our website, allhealthtv.com.